So this is a young man who came in. We had actually seen him 2 years prior and he wasn't ready to move forth with anything, but he knew something was going on. He had a crown that had fallen off once or twice, in my advice in those situations, that if it's fallen off, we almost for sure know it's going to fall off again, and there's a shorter period of time between the next time it falls off. This gentleman eventually had that tooth break off in his crown. Another fun fact about this case is that he did have a narrow tooth over here, and he actually had his dentist previously make his other tooth a little bit bigger to get rid of a little bit of a space in the middle. Obviously he came to us like this and didn't feel comfortable going to work the next day, looking like that. What we were able to do then is we were able to remove that tooth. We were able to put a dental implant in that same day. An immediate implant is what that's called, and then we were able to put a tooth on it the following day, what we call an immediate tooth replacement for that. Now this temporary tooth that we're putting on the newly placed implant is going to be temporary. It's going to be made out of acrylic. The other thing about it is that he's not necessarily going to be able to bite with it while that implant is healing. It is screwed in, so it's not going to come in and out maybe like a flipper or like a temporary tooth that might be on a retainer, and so that this is a little bit more stable and a little bit more comfortable for him, and he doesn't have to worry about it falling out or moving on him or anything like that. So this is us placing that temporary tooth not long after. You can still tell things are still healing up in that position, but a nice fun fact is that we didn't have to numb him up to put that in the following day. One of the nice things about this is underneath the hood there, is that this also will start shaping the gum tissues to make sure that we don't lose that over time. So again, this was right after the procedure was done. This is what he looked like at the 2-week mark. You can tell that he's healed up. There's a little bit less oozing, a little bit less swelling there. As mentioned before, this tooth is a little bit wider and he wanted it that way. He knows that in the future he may get that one done as well, so they can have 2 evenly shaped teeth. But this is something that he's got in his mouth. He doesn't have to worry about smiling at work or having a space there. That's underneath the hood there. You can kind of see the gums have that nice triangular scalloped architecture again. And our goal for him is to get a final tooth on there 3 months after that implant was first put in, to get a tooth that he would be able to bite with and chew with and not have any problems with in the future.